you doing today?
Good, how are you?
Good. My name is Christina. I'm going to be your nurse.
Okay.
You give me just a moment. I'm going to provide for some privacy.
Okay.
Alright, we already did your vital signs. Now I'm going to be performing a head-to-toe assessment, but can you verify your name and date of birth for me?
My name is Rachel Brannon, and my birthday is January 18th, 1992.
Let me check that. Okay. Now I'm just going to make sure I have my supplies. I'm going to wash my hands. Okay. Are you comfortable?
Yes.
Okay. I also need you to verify where you're at, the dates, and the President of the United States.
I am at the hospital. It is August 21st, 2017, and Donald Trump is our president.
Speech is clear, patient is alert and oriented, posture is upright, and hygiene is good. Okay, now I'm just going to inspect your head for any bumps, lesions, or parasites. No abnormalities are noted. Now I'm going to be performing a confrontation test, so if you could just close your eyes and tell me where you feel my finger.
Okay. Forehead, right cheek, left cheek, chin.
Okay. Now I need you to smile, raise your eyebrows. Okay. Cranial nerves number 5 and 7 are intact.
Okay.
Okay. Now I'm just going to observe your eyes for redness or discharge. No abnormalities are noted. I'm going to be shining a light in your face, so if you could just look at me. Pupils are equal, reactive to light and accommodation. Now I'm going to be testing your extraocular eye movements, so if you can follow my finger without moving your head. Start here. Okay, now follow the middle of my finger. Cranial nerves number 3, 4, and 6 are intact. Now I'm going to be assessing your peripheral vision, so just cover your eye for me. And tell me when you see my fingers wiggling.
Now, 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 now.
Other eye.
Now, 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 now.
Cranial nerve number 2 is intact. Okay, now I need you to say "ah" for me. Okay. No abnormalities noted in mucous membranes or general dentition. Can you move your tongue from side to side? And swallow for me. Cranial nerves number 9, 10, and 12 are intact. Okay. Now if you'll place your finger over one nostril and breathe in. Do it to the other nostril. Okay. No abnormalities noted in nasal patency. Can you tilt your head back? Okay. And there are no discharge or deviations. Next, I'm checking the ears for cerumen, discharge, and other lesions. No abnormalities are noted. Okay. Now, can you close your eyes and tell me which ear you are hearing the sound behind? Right ear.
Left ear.
Cranial nerve number 8 is intact. Okay. Now I'm going to palpate your lymph nodes. Submental, submandibular, tonsillar, preauricular, postauricular, occipital, anterior cervical, posterior cervical, and can you shrug your shoulders for me? Supraclavicular. Okay. Now I'm just evaluating your thorax. Apitilateral is 1 to 2. Breathing is even and unlabored. Now I'm just going to go behind you and I'm going to assess your spinal alignment, so if you'll give yourself a hug and lean forward. No abnormalities noted in spinal alignment. Now I'm going to percuss your kidneys for costovertebral tenderness.
Nope. No tenderness.
No tenderness.
Nope. No tenderness.
Okay. Now, if you'll take a deep breath out of your mouth, I'm assessing thoracic expansion. Okay? Thoracic expansion is equal and symmetrical. Now I'm going to test for vocal fremitus. If you could say 99 3 times for me.
99, 99, 99.
No abnormalities noted in vocal fremitus. Now I'm just going to auscultate your breath sounds. Okay. So every time you feel my stethoscope move, can you take a deep breath out of your mouth, please? Lift up this arm for me. This arm. Okay. Breath sounds are even and unlabored. Now I'm just going to check your carotid pulse one at a time. Carotid pulse is strong and even. Now I'm going to auscultate your heart sounds. I'm going to start with the aortic heart sound, which is at the second right intercostal space. The pulmonic at the second left intercostal space. Erb's point at the third left intercostal space. Tricuspid at the fourth left intercostal space. And mitral at the fifth left intercostal space, medial to the midclavicular line. Okay. Now if you lay down for me. Okay. Your abdomen appears flat. Now I'm just going to auscultate your vowel sounds. I'm going to start in the right lower quadrant. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Now I'm going to palpate your abdomen. I'm going to press down on your stomach, so if you can tell me if you feel any tenderness or pain. All right, right lower quadrant,
No pain.
right upper quadrant,
No pain.
left upper quadrant,
No pain.
left lower quadrant.
No pain.
Okay. Have you had any problems urinating?
Nope.
Okay. And when was your last bowel movement?
This morning.
Any problems with that?
Nope.
All right. Now I'm going to just check your arms for edema and swelling. And your legs. Skin is warm, dry, and intact. Now I'm just going to check your capillary refill. Capillary refill is less than 3 seconds, which is normal. You can sit back up for me. I actually need you to stand up, close your eyes, and put your arms to your side. Romberg test is negative. Okay. Now I need you to take 3 steps towards me and 3 steps back. Okay. Gait is symmetrical and even. Sit back down for me, please. Okay. I'm gonna test your arms, legs, and neck for range of motion. So if you could just twirl your head backwards and forwards. Your arms backwards and forwards. Okay, and your legs backwards and forwards. Okay. No abnormalities noted in range of motion. Now I'm going to go ahead and test the strength in your extremities. So I need you to push down against me. Push up against me. Push down against me. And push up against me. Okay. Extremities are strong and equal. I need you to shrug your shoulders up against my hands. Push your face against my hand. Push your face against my hand. Cranial nerve number 11 is intact. Okay, now I'm going to test your reflexes. So if you want to hold your arm at a 90-degree angle. Some of your triceps reflex. Relax for me. Okay. Bicep reflex. And brachioradialis reflex. Okay. Patellar reflex. Bless you. Excuse me. Okay. Achilles reflex. Okay. And plantar reflex. Oops, I'll leave that on. Okay. Now I'm going to be testing for ankle clonus, so relax your foot for me. I'm just going to wiggle it around a few times. Okay. Now I'm just going to be checking your pulses. The radial pulse. Radial pulses are strong and even. The brachial pulse. Brachial pulses are strong and even. The popliteal pulse. Popliteal pulses are strong and even. Posterior tibial pulses. Posterior tibial pulses are strong and even. And the dorsalis pedis pulses. Dorsalis pedis pulses are strong and even. Okay, are you comfortable?
Mm-hmm.
Alright, I'm going to wash my hands. And I'm going to go ahead and document my findings. Your call bell is right here, just let me know if you need anything.